I want to tell you a story about how healthcare teams and patients have been working together to improve care for people diagnosed with cancer. And the really good news is that advances in research and treatment mean that lots more people are surviving cancer. But the not so good news is that more people than ever are also getting cancer. So, as more people survive cancer and more people get cancer, our hospitals are becoming full to bursting, and this is happening as we're facing financial challenges. Our story starts in 2009 when the National Cancer Survivorship Initiative was set up, a partnership between the Department of Health, Macmillan and NHS Improvement. One of the first things they did was map what matters to cancer survivors. Patients spoke about fear of recurrence, incontinence, difficulties at work, feeling abandoned after treatment, and they also talked about the importance of better information and advice and knowing the key person to contact if they had a problem. They said this would help them to return to as normal a life as possible. The next piece of the jigsaw involved reviewing cancer services. The review found excellent examples of good practice, but also found a lack of consistency, and staff said that sometimes the services weren't available to support patients' holistic needs. Next step was a group of expert clinicians and patients working together, and they agreed that if services could be redesigned to better support patients' needs, they would be able to manage their own health. This could result in less outpatient appointments and teams being freer to help patients who had more complex problems. So, several healthcare teams across England worked with NHS Improvement to test new ways of working. Patients and health staff developed assessment tools that helped identify patient needs. The assessment tools weren't just about physical needs, but about psychological, social and practical needs, things like work and finance. They also worked together to develop information that helped patients understand their treatment better. The patient's needs were written up in a care plan, and the plan outlined stuff that would help patients get stronger. Things like a referral to a counsellor to help a patient manage their anxiety, or information about a support group where patients could buddy up with others in the same boat. Being physically active is really important if you've had cancer because it reduces the likelihood of cancer coming back. So, teams in the test sites taught people both one-to-one and at group information days about what they could do to keep active, highlighted clubs they could join and what they could do to keep themselves strong and positive and healthy. The teams learnt how to have conversations that encouraged and motivated patients to adopt healthier behaviours. And the teams found out about what was happening in local communities, what the charities offered that they could signpost people to. And there was so much more out there than they realised. Things like gardening and walking clubs that can help fatigue. The other really important part of the pathway focused on making sure patients knew about what signs to look out for that might mean the cancer had returned, and staff explained about possible long-term effects of treatment. And this was all written up in a treatment summary for them to take home and a copy sent to their GP. This all resulted in care being much better coordinated. The teams made sure patients knew when their surveillance tests were due, they had all the information they needed, and a hotline to call if they were worried or had any concerns, and made sure that patients could see their specialists again quickly if necessary. And all this meant that patients got more confident, and lots of patients didn't need their routine outpatient appointments anymore. The new system that sent the test results by post was so much better. So, in conclusion, the new pathways are about two key changes. First is health teams delivering a more personalised approach to care and supporting patients in managing their health. And the second is about patients taking more responsibility and keeping themselves as healthy as possible.